This year, an estimated 70,000 Canadians will have hip or knee replacement surgery to regain their lives of movement. Research shows, and most healthcare professionals would agree, that the more you know about your surgery and your role in your return to mobility, the better your results will be. In hip and knee replacements especially, the patient plays a critical role in the preparation for and recovery from orthopedic surgery. This three-part video series is designed to help you learn about your journey through the orthopedic care path and how you can be an active participant in your regained mobility. Patients who are going to have a hip or knee replacement operation are typically asked to come to the hospital 2 to 4 weeks prior to their planned day of surgery. This is a visit to the preoperative area where they'll be prepared for the operation itself. Patients typically are seen in the preoperative area by a member of the Department of Anesthesia who will discuss the type of anesthetic they'll receive. They're also seen by nurses who provide some preoperative teaching to explain to the patient what to expect during and immediately after the operation. They'll also undergo a physical examination, have some blood work done, probably have some x-rays and an electrocardiogram. Finally, they'll be seen by people from the departments of occupational therapy or physical therapy to explain to the patient what to expect in their immediate post-operative rehabilitation and to assist them in returning home.
Pour me préparer pour la journée de ma chirurgie, j'ai suivi les instructions de mon chirurgien orthopédique à la lettre. La veille de la chirurgie, j'ai préparé mes valises et j'ai arrêté de manger et de boire à l'heure qu'on m'avait indiquée. J'étais un cas un peu particulier pour une chirurgie car j'avais un régime alimentaire spécial à suivre, alors il a fallu que j'amène mes propres aliments à l'hôpital. Mon chirurgien et le personnel de l'hôpital étaient très accommodants. Donc, si vous avez des besoins particuliers, n'oubliez pas d'en parler à l'avance à l'équipe de soins de santé.
Patients should ask the nurse in the preoperative visit what specific items the hospital would ask them to bring. But as a general rule, patients should bring their own clothing, slippers, personal items for grooming, and their own medications in the original labeled containers. Patients frequently will be given medication in the hospital, but people want to know what medications they're taking at home.
Je suis arrivée à l'hôpital 2 heures avant l'heure prévue de la chirurgie. J'étais tellement excitée de savoir que la chirurgie allait améliorer la qualité de ma vie. Je me suis présentée à l'admission du service de chirurgie d'un jour et j'ai parlé à l'anesthésiste. J'avais choisi d'avoir une anesthésie locale, mais j'aurais pu également avoir une anesthésie générale. L'infirmière m'a préparée pour la chirurgie et ensuite nous sommes allés vers la salle d'opération pour avoir mon nouveau genou.
On the day of surgery, patients will be given a specific time to come to the hospital prior to their operation. It's very important that they keep that date and keep that time. And a certain amount of time is required between when the patient arrives in the hospital and when they go to the operating room. And during that time, the patients will be assessed by one of the nurses, their blood pressure taken, they'll be asked to change into a hospital gown, and given an identification bracelet, which they're worn throughout their hospital stay. They'll also be given some medication to help them relax, get ready for the surgery, and in some hospitals, they'll be taken to a special preoperative holding area where they'll wait with other patients to go to the operating room. The patient's brought into the operating room on a stretcher, and they're transferred from the stretcher to an operating room table. There they're positioned for the surgery. Their area to be operated on is cleaned, and then they're given an anesthetic so the operation can begin. Patients are generally given either a regional or a general anesthetic. A general anesthetic puts the patient to sleep so they have no memory of the operation. A regional anesthetic numbs the part of the body that's to be operated on. The type of anesthetic will be decided by the patient, the surgeon, and the anesthetist. Whatever's best for the patient is the type of anesthetic they'll receive. The patients in the operating room, generally between 90 and 120 minutes, for a single surgical procedure. A single hip replacement or a single knee replacement, as a general rule, takes that period of time. If they're having 2 knees done, or rarely 2 hips done, the time is correspondingly longer. When the surgery is finished, the patient is taken from the operating room to the recovery room. They'll be looked after there by nurses who will monitor their blood pressure, respiration, and pulse. There are a number of patients in the same area, and so there are a lot of nurses and a lot of activity, but all of this is normal and actually helps the patient to recover. When the anesthetic wears off, the patient will experience pain. It's important that they verbalize this pain to the nurse who's providing their care, perhaps using a scale 1 to 10, 1 being no pain and 10 being severe pain. This allows the nurse to provide them the appropriate amount of medication, which will control their discomfort. Complications after these operations are extremely rare, but the recovery room nurses are trained to look for specific complications. They'll examine you and make sure that there haven't been any complications during or immediately after the operation. Most of the complications are minor, really not much more than an inconvenience, and serious complications are very rare. Joint replacement surgery is associated with a small number of well-defined complications. Minor complications consist of things such as constipation or nausea related to the medication patients take for their pain. More serious complications like anemia, blood clots, infection, and swelling can occur, and it's important that they be managed appropriately. Patients can learn more about this through materials provided by the Canadian Orthopedic Foundation, either in booklet form or on their website. Anemia occurs as a result of blood loss during surgery. Your surgeon will be aware of this prior to your leaving the hospital and will almost certainly prescribe iron or other supplements for your diet. Rarely is a transfusion required. Blood clots are a recognized complication of joint replacement surgery. In order to prevent blood clots, patients will receive a medication known as a blood thinner after their operation, which they'll continue to take after their discharge home. This medication prevents blood clots from forming and prevents serious complications such as a blood clot forming in the leg and then traveling to the lung, causing serious health problems. There are a number of different medications, either pills or injections, and it's important that patients understand the importance of this drug and the time that they are to take it. Infection is a rare complication of joint replacement surgery. Patients will receive antibiotics around the time of their operation to decrease their chances of infection. Once the patient is discharged home, however, it's important that they provide proper care for their incision. These instructions will be given to them at the time of discharge. If they do develop redness, swelling, or any drainage from their incision, it's important they contact their surgeon immediately. Swelling is common following joint replacement surgery, and patients can minimize this by keeping their operated limb elevated when they're sitting or lying down, and also not to allow their operated limb to hang down when they're sitting in a chair. Activity, moving their foot and ankle, is very important in minimizing swelling, and I tell my patients the more they walk, the better you'll be. Patients who understand the possible complications of surgery are much better equipped to manage those complications in partnership with their surgeon or other healthcare professional. Patients should be engaged in their care, make sure that they are prepared to deal with any complications that arise, and communicate fully with their healthcare professional. Patient length of stay after surgery is determined by many factors, including the type of surgery the patient has received, their home environment, and their general health status. Most patients will go home 4 to 5 days after the operation, but some patients may stay longer or may be discharged to a rehabilitation facility to maximize their recovery. Patients won't be discharged home until they're independent and self-care. However, it's important that they have someone at home with them to assist them in their care. They should also make sure that their prescriptions are available at the home when they arrive. They'll be given instructions on how to care for their incision, and it's important that they follow those instructions carefully.
Avant la chirurgie, les inquiétudes n'existaient pas vraiment parce que tout m'avait été très bien expliqué. Je savais comment les surveiller et quoi faire si les signes se présentaient. Je savais aussi qu'une meilleure qualité de vie m'attendait après la chirurgie. Et cela l'emportait largement sur les inquiétudes que j'avais au sujet des risques et des complications. Une fois la chirurgie terminée, l'infirmière m'a amenée à la salle de réveil. J'étais très alerte car j'avais choisi une anesthésie locale. Je ressentais de la douleur parce que la chirurgie venait de se terminer, mais le fait de ne plus ressentir une douleur insoutenable m'encourageait et me motivait à récupérer totalement. J'ai passé les premières 24 heures à me concentrer au processus de guérison et à me préparer à une vie sans douleur. Je dois vous avouer qu'après la chirurgie, je voulais vraiment sortir du lit et d'essayer de marcher, mais je savais qu'il était très important de se reposer et d'entamer le processus de guérison. Les infirmières ont fait en sorte que la douleur soit bien gérée à l'aide de médicaments et que mes pansements soient intacts. La physiothérapeute est venue me rencontrer afin de discuter de mon programme de réadaptation. Le lendemain, j'étais debout et j'ai marché les couloirs de l'hôpital. Mais il est très important de se rappeler que l'expérience de chacun est différente. L'équipe de soins qui s'occupera de vous saura ce qui est de mieux pour vous. Assurez-vous de bien suivre leurs instructions. Votre bien-être leur tient à cœur et ils vous aideront à commencer le processus de guérison.
The OrthoConnect program puts patients in touch with individuals who've had an identical experience, and it allows them to ask questions of people about their surgical experience and the results of their operation. You can get in touch with the OrthoConnect program on the website of the King Orthopedic Foundation or a 1-800 number, which will allow you to talk to someone who's had the same experience you're facing. I think everyone should use the OrthoConnect program.
Le programme Connexion Ortho aidera un patient à comprendre la chirurgie en parlant avec quelqu'un qui a vécu une intervention similaire qui peut vous aider à comprendre ce à quoi vous devez vous attendre lors de votre chirurgie. Le programme Connexion Ortho de la Fondation canadienne orthopédique vous mettra en contact avec un bénévole qui a vécu une chirurgie de remplacement de hanche ou de genou et qui sera en mesure de partager avec vous son expérience.